CBS News medical contributor, that's Dr. David Agus, joins us now to bring us up to date on all the latest COVID stuff. I want to pick it up, David, with where Meg just left off, that they did not require a negative test after 5 days of isolation. That struck a lot of people as not making any sense. Did it make sense to you?
Certainly, if we had the resources and the ability, I think a negative test at 5 days makes all the sense in the world. When you look at the data, it takes about 7 days till most people start to test negative, and some even longer. So having that negative test is a way to stop the virus. The problem is we are still limited with testing in this country.
But I also heard the CDC say that sometimes you can test positive even though you're no longer emitting any of the, you can test positive although you're no longer dangerous. And that's why they said, listen, you don't, after 5 days, you're okay. It was very confusing.
Yeah, I mean, there isn't, you're right, there is an issue, is that the test looks for 30 letters, the 30,000 letters of the code. And you could see that in viral fragments. So you may test positive even though you're not infectious. And we've seen people test positive several weeks out without being infected. So it's not, a simple answer. Certainly, if you test negative at 5 days, it is safe for you to go out with a mask over the next 5 days. The real question are the others. We need more testing. Testing needs to increase across the country to be able to stop the spread of the virus.
Let's talk about the kids going back to school, because schools really seem to be trying to figure this out. Do you think it's safe for children to go back into the class today?
I think we're going to have to, we have to have in-person learning. And what we need is, again, more testing in the school. So testing should be mandated in schools. And if you test negative, you can go to school. I think that's the way we should be doing things. And much of the world is doing that, particularly in the European countries. And you have to have a mask mandate when numbers are up, like they are in most of the country with Omicron.
And let's talk about the number of Omicron cases. We keep hearing the numbers are very scary, David. You hear 300,000 that they've topped. We keep hearing it hasn't even hit the peak yet. Should we be focusing on the number of cases or the number of hospitalizations? How scared should we be about this number?
I think you hit it, Gayle. I mean, we had 500,000 cases in a day over the last few days. And so hospitalizations are what matter. If you look at a state like Maryland that has one of the highest vaccination rates, they're at the highest rate of hospitalization they've been in throughout the almost 2 years of the pandemic. So there are places now where particularly unvaccinated individuals with the rapid spread of Omicron are basically filling up hospitals. We're canceling elective procedures in much of Los Angeles. I've had patients, cancer patients, where their surgeries for cancer have all been canceled over the last week and going forward because hospitals are being filled up. And what we need to focus on is that number, because that is what's limiting our society in many respects. And so Omicron will spread. We're going to peak over the next several weeks, particularly in areas that had an early onset of Omicron, and then it'll go down afterwards. But over the next several weeks, it's going to be rough.
All right, David Agus, it all boils down to, once again, you got to get your vaccinations and your boosters. Thank you, Dr. Agus. I know we'll talk again.